The pregnancy symptoms in week 9 are similar to those the woman experienced the previous week. Since this marks the very beginning of gestation, the mother's body is still adjusting and going through several changes. These symptoms may vary from woman to woman. Indeed, some expectant mothers experience significant discomfort in the first trimester, while others feel very little. All of this is completely normal, as every woman and every pregnancy is different. At 9 weeks of gestation, pregnant women often experience the following common discomforts: more tiredness, dizziness, and feelings of nausea. Pain in the pelvis due to the growth of the uterus. Increase in breast size, heartburn and gas problems, mood shifts and cravings. Fatigue and dizziness in the mother are mainly due to a noticeable drop in blood pressure, as the demand for maternal blood increases significantly in order to feed the embryo. The belly is not very noticeable yet, but the uterus has already increased in size, and it is possible that the woman has already gained a little weight.